Hi, this is Dr. Jonathan Youssef, Networking for Your Optimal Health. Today's topic is going to be about sexual dysfunction. We have some shots in the office that will help patients with this. I'm going to have with me two students, Anam and Rachael, who are going to help us figure out what these shots do and how can we help patients with sexual dysfunction. So some of the common concerns that women and men have will be explained by the two students. So if Rachael, you want to begin?
Sure. Men often struggle with erectile dysfunction, decreased sensitivity, decreased strength of their erection, and decreased girth. This could be due to aging, medications, diabetes, or even post-prostate cancer.
So some of the complaints that my patients explain to me or describe as their sexual dysfunctions are having trouble with maintaining the erection and having an orgasm. So typically for men, it's not necessarily their size that they're concerned about, but maintaining that erection until completion. And some of the medications that we've had over the years include like Cialis, Levitra, Viagra, have been very helpful with those increasing the blood flow to that area, but not necessarily the sensitivity. And then also having an orgasm as well. In fact, some patients do complain that they have a difficult time getting an orgasm despite using those medications. For women, I do agree with you. They complain of, vaginal dryness, vaginal atrophy, trouble having orgasms, sensitivity, the painful intercourse. Mm-hmm. So, in terms of sexual dysfunction, these are very common complaints that we have. And we have some treatment plans. Of course, there's prescriptions and over-the-counter treatments, but Anam, can you explain to us what treatment we offer in our office?
So in the office, we offer some PRP-based shots for male and female sexual dysfunction. Essentially, what this shot is a platelet-rich plasma, which has been around for a long time and been used for things like orthopedic surgeries, soft tissue injuries, cosmetic procedures, but it is now being used for things like sexual dysfunction in males and females. Essentially, what you're doing is you're drawing blood from the arm and you're spinning it down so that only the platelets are left, which then, being infused with growth factors, are able to promote collagen distribution and fibroblast formation. So essentially what's happening is when the PRP is activated and it's injected into different anatomic areas like the clitoris and the Skene's gland, these factors then stimulate growth and they stimulate a physiologic response, which then helps with sexual dysfunction in both men and women.
I know that you mentioned for women that they're using it for urinary incontinence. Can you explain to us more about that?
Sure. So for women, you can get the PRP injected into areas like the clitoris.
But also you can get into the superior portion of the vaginal wall.
Yes.
So that it can stabilize the
pelvic
floor. Exactly. Mm-hmm. And what happens after having a baby, those floor muscles are stretched. And so that you inject this PRP in there, which also kind of hardens a little bit, mm-hmm. and also forms a little bit of a support system for that pelvic floor so you can control your urination a little bit better.
Yes, yeah. Exactly.
So when you guys had, during our office, your rotation, have you seen any injections of PRP or have we done any training here?
I haven't seen any, but we did offer it to multiple patients who are still thinking about it.
Yeah, we did have a training session basically, I think just before you guys came along, and mm-hmm. we did inject a couple of patients, and we've been doing PRP for many years using these injections for musculoskeletal injuries, mm-hmm. basically knees, back, shoulders, and we've had a great deal of success. Some of the rate limiting issues have been just cost, mm-hmm. because the PRP is a little more and it's not covered by traditional insurances. So people do have to consider paying out of pocket. and that kind of limits it. But other than that, I think we've had great results. Essentially, it's your own blood spun, platelets removed, and then these platelets create a great deal of growth, revitalization, re-energizing the area, and improving it. In fact, she mentioned that there's some possible stem cells that can be activated in that area just from having the injection. So there's so many factors going into why we think PRP works, but we can combine it with other treatments. So it doesn't have to be a standalone treatment. But are there any other situations where you guys have seen PRP in other clinics or any other offices?
Well, I know that you also used it for somebody who had hair loss here, and it's been working very well.
Another area that I've seen PRP used a lot is in the realm of aesthetics and facials, where they'll also do the same thing and take your blood, spit it down, and go ahead and just basically apply it on your face with some microdermabrasion. And that also helps with collagen formation and just tightening and firming the skin.
What have you seen, Rachel? I know that you wrote a couple of things down regarding what you expect patients to experience when they do the procedure, or how they're affected by it.
Well, for men, within 8 to 12 weeks of their shot, they're supposed to have increased circulation and blood flow, stronger sexual desires, improved strength of erection and firmness, increased sexual stamina, and possible increased length and girth. And for a woman, they should have stronger orgasms, increased sexual desire, increased natural lubrication, and decreased urinary incontinence symptoms.
Typically, I think that this is kind of a difficult topic to discuss with your patients. I know that we have some questionnaires, and patients come in for, just a refill on Cialis or Levitra. But for some of the women, they also complain that they're having some difficulty with, sexual desire, painful intercourse. And so with that in mind, would you guys feel comfortable offering these treatments, or are there other, let's say, non-medical treatments that could be used, or medical treatments that are not the PRP injections? Do you guys know of any or recommend anything, or have seen, in gynecology, do they recommend doing anything?
Well, things like incontinence and, any kind of pelvic floor dysfunction, you do have things like, pessaries and doing kegel exercises and things like that, which essentially help strengthen the pelvic floor muscles.
What are the kegel exercises?
So Kegel exercises are essentially a way of strengthening your pelvic floor muscles. So what you do is you can start by lying on your back and basically trying to contract those muscles and relax them, but making sure not to use any other muscles to help, like the abdomen, the legs, or the buttocks.
Sure. I remember being told that the way you do it is as if you're trying to stop your urination.
Exactly.
Rachel was I think she was about to tell us.
Well, that's basically what I was going to say, but you have to try to do it 10 times a day, and you want to hold tight and count to 8, and then you let go, and then you repeat it 10 more times, 3 times a day.
Interesting. I think that is doing the Kegel exercises in general something you should be doing, like exercise?
Yeah, so we would definitely recommend them, especially after pregnancy, if you're dealing with any urinary incontinence or having any other issues bladder-wise.
Yeah, I know that there are alternatives to the Kegel exercises. Some gynecologists are recommending lasers. Have you heard anything about those?
A little bit. I have heard more about checking hormones and seeing if they need estrogen creams or any other pills to help.
Yeah, I think especially when women are approaching menopause and getting older, a lot of times they suffer from, things like vaginal atrophy and decreased lubrication. So a lot of what I've seen has been, topical creams and things like that, using lubrication during intercourse, just some conservative measures as well as some medications. But I think this is a very good alternative that's safe and non-surgical for long-lasting results.
No, definitely. We have in our office, we do check hormones for postmenopausal. And I think today we kind of recommended a combination estrogen testosterone cream, which can be applied vaginally so that it can help females who are in the postmenopausal symptoms, who have most postmenopausal symptoms. For men, typically I am using the traditional prescriptions, and they're PD4 inhibitors, correct? So that's Viagra, Cialis, and Levitra. And they are very effective, and I start using them first line. They're easy to take. They're you can use them as needed, or you can even take one daily now called Cialis. As well as there are some advancements to. They have a few machines right now that can help rejuvenate the genitals for males. But we did have a patient with prostate cancer who was just seen the other day, and we had to discuss with him using injections, so prostaglandin injections. So they have these small injections you can apply to the side of the penis or where the corpus cavernosum is. And this helps a great deal in having an erection the same day, of course. In addition, he was prescribed a penis pump, so he was taught how to use this pump as well. And basically, just like exercising, like the kegel exercises, you use this several times a week, and to help with erections and maintain them, especially post-surgical prostatectomy. And there's also these lasers that I've seen at the gynecologists, which help to rejuvenate the area. But recently, I know there was some FDA recommendations. Rachel was going to explain.
Recently, the FDA has decided that these lasers for vaginal rejuvenation should not be used. They think that these lasers can cause serious risks and don't have adequate evidence to support their purposes. They think that in the end, they actually might destroy and reshape vaginal tissue in a worse way.
Yeah, so it looks like maybe rethinking lasers is kind of a new thing, making sure that we offer different options for patients. So I think that when we're dealing with female and male sexual dysfunction, it's a complicated and sensitive topic, but I think it's important to talk to your primary care doctor and see what alternatives we have instead of the traditional medications. So some of them may or may not be effective for you, and not everything works for everybody. So here are some options that may be very useful. In general, I know, Anam, you said you had some final parting words.
I think if you're somebody who feels like they've gone through conservative measures and they've tried traditional medicine and are looking for alternate options, then this is something you should definitely consult your medical provider about. This is becoming more and more common, and it's being used in multiple different fields. So definitely ask your provider about the optimal shot.
Well, thank you. And Rachel, thank you for joining us, both you guys. We really appreciate you having on the show. This is Dr. Jonathan Youssef, Networking for Your Optimal Health.